Hi, this is Steve Stratton. I'm a physical therapist, and I've been one for 49 years. And for those that are on, the social media, you've seen me do exercises and manual therapy. But for this one, the theme is going to be kind of my medical history, because it's pretty large because of the things that have happened in my life, most of it from sports. But I think that will help you, because I've worked through most of that, so where you wouldn't know that I have this kind of disability. The first one happened at 9 years old. My dad had this, and I was living in Grass Valley, California. And my dad wanted to raise turkeys so that we'd have fresh turkey for Thanksgiving and Christmas. And so we had built a pen for them, and we were doing the gate, and they show up with the turkeys the day before they're supposed to be there. So my dad then, we were hurrying, so he was up on a elevated thing to be able to hit the top of a 2-inch pipe, steel pipe, and I was holding the pipe, perpendicular to the ground. He's pounding it in. Then we put one next to it. When he got the height he wanted 2 on each side, so the gate would be sturdy. And so I have my hand over the one he's already pounded in, and the other one's up here. You can't see that probably in there, but it was, probably 3 feet higher than my hand. And then my dad slipped and hit my hand, crushed this finger, and it was on the ground, and broke this one. You can see how that's curved. It broke fractured the distal phalanx on the long finger. Now that hurt really bad, but here's the blood squirting out of it, and I was screaming and nobody could hear it because I was like this. It was above sound. I mean, it's the only time my dad was like, you could tell he just felt really bad about it. But my dad was a pharmacist mate, a medic in the Navy during World War II. So he knew what to do. He took the finger, put it in ice, and then compressed my finger, and we had ice on it, and he went in and called to see if he could get emergency in Sacramento. Happened to be a board-certified hand surgeon, which back in the 50s, you wouldn't really think that would, they had that. And he was there visiting for something, and so they said, yeah, you have somebody and come in. So that's about a 60-mile drive, because you go down to Auburn, and then you're following Interstate 80 into Sacramento, California. And what they did is they put it on, and you can see it's curved a little bit, but it had smashed it and turned it way over here. So he did an arthrotomy right here and put that in, and he kept only bit I had of the fingernail, which means he knew what he was doing, because that keeps your sensation. But of course, this is all would crack, in doing sports. But anyway, that was, he made it to where it fit into my fist, and that really hasn't bothered me much, even with my sports. Football would be more than in wrestling, especially not in track. Okay?
Real quick, I'll cut this little part out. Remember to put an emphasis on your age, and like these injuries you've had haven't prevented you from leading a healthy lifestyle. Remember, that's the kind of the through,
Okay.
right?
Okay. All right, and so now the second one is wrestling. in high school. I was a freshman. In fact, I was the only freshman in varsity in California because the guy, I wasn't planning to be a wrestler, but as a freshman in California, you had to be a freshman football and you couldn't do varsity, kind of like the same as the NCAA was till '71. Then they allowed freshmen to be on the varsity team. And so I was, we were working out and kind of slipped somehow, and instead of on my shoulder, I stuck my hand out and had a Colles fracture right here. And I missed like 3 weeks, and then I had to wear a little bit of splint, and then I was back in, and this was at the very beginning. So the first couple are just kind of like in football, we'll play with a school that isn't in our conference, so it doesn't make any difference if you win or lose. But the reason I'm going through all these is that you're going to see that I've been able to have a healthy lifestyle. I've recovered from all these. And the next one is at 18, when I was playing football in college, and I went there really as a middle linebacker, but my senior year in high school, I was faster than the fullback, so I said, I want to try this, because I was right guard and then middle linebacker. And the coach said, yeah, whoever wins, then, and I could beat, Tom Anilski was his name, and so I then, at that point on in high school, I was averaging about 250 yards a game. So we're down on the 5 yards and have 95 yards to go, and we were doing what's called the Houston veer, where kind of like triple option, but you go in the gap between the center and the right guard, and then they block down, and then you cut because they've taken all those people out of my way, and then I made it all the way down. One of the guys in the team, the opposite teams, trying to catch me, and he was faster than me, but I'd already gotten to about the 20-yard line. In other words, I was getting close to being there, and he just caught my toe, and I fell on my knee and tore my ACL, but not all the way. Now remember, we didn't have MRIs and all that kind of stuff, but it was looser. I then went through what's called a pesplasty, because they didn't have anything that was really good, and one of them was taking your IT band out, and I wasn't a PT yet, but that didn't seem right. So they took the semitendinosus, the tendon. So if you sit and tighten your hamstring, you feel one with a real long tendon. That's the semitendinosus, and then the one in the middle is the semimembranosus. And he took that and put it over here, which gave me a little bit of stability, and I played 3 more years of college football with no brace and no problems in doing that. Then later, while wrestling, and so this was, again, freshman year, and in college, and I had beat the senior, and I was in a match at Colorado State, and I went out to do an outside single, picked the leg up, and then went to move, and I feel this clunk, and I fell on the ground, and that's when I completely tore the ACL. And the pesplasty, though, was still intact. So it didn't really change anything And just for your information, we were the first team to power lift about a year and a half ahead of the NCAA. So I was getting stronger, and then I played the rest. I didn't miss even 1 week. I wore a brace just the one time just to see, but didn't have any swelling because must have been pretty much all close to being all the way torn. But I was able to do that all right. Okay, at 21, I had damaged my finger. I did a fracture dislocation, and that was not 21, I was 18, 19, I was 20, because it was my junior year. And so you know how you just double tape? I double taped it and then played, because I had to be able to catch a ball. Well, the problem is, then it got where I could take this and bring it all the way over to here. And so I had it fused, and that went on for, you know, a couple years. I didn't get it fused until I was 25. So I was in the Army, and he was a hand surgeon. Now he goofed up, because see, they should all come and point to here. Cutting that out decreased my hand grip strength a lot, because your power comes from this side, not this side, you know. And that took away my 250-pound grip that I had down to like maybe 180. Okay. Then at my next one is when I was 39, because of all the hitting, being a blocking, you know, fullback in college. I had arthroscopy of the shoulder because I had a lot of bone spurs, and I weighed 320 there because that's when I was powerlifting, and he was using the tube to go down and to get some out, and he couldn't do that because it wasn't long enough. So he had to stop the surgery because they didn't have one in the hospital he was at. So once they bought one, about a month and a half later, I had it done again and cleaned out the bone spurs. And anytime, you know, you have surgery, the shoulder, all these muscles just went to, you know, and so it took me like 8 months to get my strength back. But I had full range, and I've never had a problem with it since. Then the next one was at 48 years old. Now this was one of my more stupid things I ever did in my life. I was visiting my son Ben, who was in Utah at the time, and we were playing contact football, and it was winter, so it was snowing, with Ben and all his friends. Ben weighed about 210, all the guys weighed about 210, but I weighed 320. And so we had where, you know, you couldn't hit below the knees, and I'm playing as a lineman because I'm the biggest one there. They're all 200. And then one of the guys was a good friend of Ben who was there, but he went to high school in Roosevelt High School, where they did in San Antonio. So he was always at my house. I knew him, and he was mouthing off. So I clotheslined him because he was mouthing off. His feet went over the head. I gave him a third-degree concussion, and he ripped off my biceps right there, right in the center. And remember, we're covered, and I go, oh, that kind of hurt. And so I played another hour and a half. When I took it off, it was pure black, my whole arm. And my wife goes, dumb shit. And she's right. But I could only lift 3 pounds. That was with the brachialis, because I had no biceps. My biceps piece attached right here, so I got biceps right there, which isn't it's more for looks. But I got up to 30 pounds. I can't make that brachialis do more than 30 pounds. Interestingly, I can do anything I need to do. Now, if I was competing wrestling and had to jerk way down, I probably wouldn't be as effective. But for the, about the first 6 months, you know, I couldn't even pick up. One of my granddaughters weighed like 78 pounds, and I grabbed her like this, and I hit my hand at her because it was going to go down because my biceps was doing the whole hold. Okay. Then we get into now all the results are happening from all the contact I did in trauma with football and wrestling. And in 2014, my hip started bothering me before my knee, even though my knee was unstable, but and it was bone to bone. So I had to have a left total hip replacement, and I had the anterior approach. So I have an incision right here. That's it. So and Amanda Marshall's the surgeon, and she had been the resident for Myers in Chicago, who did the original research on. So she had more experience than anybody else in San Antonio, and she put it in perfect. She really didn't want to do it, said, because of how big I was. I was about 260 then. I'd lost, weight, and she said, "You're probably not going to have. You're going to get numbness here from the sensory nerve because of they do it prone, and then pick it up, put it in. It's pretty interesting." I got up, walked as soon as after, waking up from after the surgery, and they did a walker first. I said, "I don't need that." I did a cane, handed that to him, walked without any weight, because I was strong. In fact, Dr. Marshall asked me the day before, like, "Did you do any? When's the last time you did weightlifting?" I said, "Yesterday," on the day of surgery, and I was doing single leg, 450 pounds. She goes, "You can't do that with this toe." I said, "Yeah, I can. Remember, it's lying down. That's not the same as picking up 450 pounds with gravity. I was laying down on it, so it was easy. And I've never had any problems with it at all. Then in 2018, my knee got so bad that I had to have that done. So again, she does an anterior. She doesn't cut the quad like most of them do to put in a total knee. And I again walked without a limp. I was doing great. Now I did do blood flow restriction, the BFR, and I did that 3 times a week for a month beforehand in my legs. So I had them pretty pumped up. So she had to do so much work. It took 5.5 hours. So she had to, take my blood out and strain it and put it back in, because I had 600 cc's of blood with gunk in it. So the next day, I'm going to go home, and she still has the tube in to drain into a pouch, because I wasn't done with that. And the key is that I had a nurse that had just come back from having a baby, and I'm watching her, and I'm thinking, she's going to pull that thing out. And I didn't want to put my hand down there because of the sterile field. I wanted to keep it. Well, it popped it out. Knee blew up. Tried to get Dr. Marshall to drain it, and she goes, "Man, you don't want to have to go back into your knee, because the chance of getting an infection is much higher." Well, it had so much, and 2 weeks out, I conned into it, or already coagulated. And so a month after having that surgery, I had to have another one, because if I hadn't cleaned it out, it would have been a failed surgery, because I had, so much scar tissue, I wouldn't have been able to move my knee at all. And she then says, "Well, the chance of getting staph in this is going to be very high." So I conned her into putting in instead of 10 cc's, 5 cc's of antibiotics in the joint, you know, when she opened it up. She first swabbed it. That was on a Friday. By Monday, it came back with staph. So then I had to have, you know, a bolus of antibiotic. It took 4 hours to drain every day for 3.5 months. 6 months later, I'm going up the back stairs, you know, cement stairs, 8 steps to get into the clinic, the PT clinic. And I had a glass bowl with goodies in it, and the top step, my knee just gave way. Didn't have any pain, and I'm worried about the glass bowl. I fall back, land right on the bottom stairs, right there, crush my L4-5 where I had some stenosis, crush my L4 and L5 nerves, and that took 4 times of getting injections to calm that down. And we noticed that in the MRI that I had a cyst on my other side. And so the key is that I then had to, I forgot to tell the one important thing, real important thing. Besides, you know, crushing those nerves, they came back, but I ripped off my L2 nerve root. So I had a big giant concavity where my vas medialis and my hip flexor, I could hardly lift it up. So after that surgery, I kind of said, you know, wow, after the fall, this is really weak. And that's because of the nerve. And by the way, I still don't have an L2 nerve root. It is gone. Okay, and I had hardly any quad. I have all that back. A lot of the doctors says, well, you know, you won't get it all the way back. I go, yeah, you will. Muscles are double or triple innervation. And I got all that back. The problem is it's not connected to my motor cortex in the brain. So balance of standing, you've probably seen sometimes where my balance on this leg isn't good. That's the reason, because I can hold my core and get it to stay for a short time. But that made a difference. Okay, then because of the crush on my back was hurting all the time. And so I underwent a implant called a Coflex. And it's very interesting. It is a titanium, looks like a U sideways. It's about that long. And then it looks like wings up here and down here, and they cut it right in the center and go right up to the L4-5, and that then opens the foramen, and then they collapse the two. They bend them on the spinous process of the one above and the one below. And that allows the motion. So, because if it was that or a fusion, I said, no way am I having a fusion if I don't have to. Because, yeah, they may stop it initially, but 10 down the thing, you're gonna have the two ends of that fusion taking all the stress, and then they wear out quick, and pretty soon you got now a 4 level. And then it just, as you get older and older, if you're super active, you're gonna have, pretty soon your whole lumbar spine will be fused. Okay, but I've been lucky since that was 2019, I had that. And I've done pretty well. So the reason I bring that up is you can have an injury, but again, from being a PT, I knew right away after any of the surgeries to get my muscles working. I'd tried doing a straight leg raise and hip abduction because I didn't want my brain to shut it off. And I'm talking to my brain saying, hey, this is okay, we're gonna get through this. And that's how we help people with chronic pain. And the PTs are the one who figured it out, not the physicians. Okay, so as you can see, I've had a lot of a lot of things go wrong with me, and almost all those are pretty much built around doing contact sports, you know. And my wife would say, with all this, would you go back and do it? I go, yes, ma'am, I would. But I would have been probably a 300-pound running back then. I was 250 in 1973. That was my senior year. I was the same size as what the NFL linemen were. And I ran a 4.640 at 250. Back then, that was super fast. They only had one person that could beat that, and that was Hayes, who was the 100-meter gold medalist in the Olympics, then became a wide receiver for Miami and did a 4.4. You know, now we have guys that can do 4.2. You know, big difference in what, how big and strong these guys are, and that's why they get injured pretty easily. But I wanted to at least have you see that and see that I still I'm healthy. I can't do two things I really want to do. I was state champion in handball, Utah, and I'd been doing that since I was in college on my bachelor's. Tough sport, takes years to get good at it. And then I could beat guys in racquetball, and I could switch my hand because of, you know, handball, you know, you use both your hands. And that took a long time to get this hand to work. I had to look myself in the mirror and try to replace it. But that's helped me as PT as well, because my hand, I've been using it, and there's not much difference. Even when I had this done, I could write pretty decent with my left hand. Not as good as my right, but I could do everything else. So, but I just can't do those quick movements like in racquetball and handball with a total hip and a total knee.
Give me like a good closure for the video. Give me like a good like through line. Like, so if you're someone who's had maybe more or just as many injuries as I have, know that it's not over. There's still time for you.
Yeah. All right. So really, in conclusion, there's people that have had, you know, some of the same things I've had, surgeries maybe for different reasons. But I can tell you, if you apply yourself and do everything you need to do, you can get back and be very functional. Now, if you have, you know, like a stroke, yes, you can improve it, but you know, you're not going to make it normal. I'm talking about people that have everything else that's working okay. But most people stop, and then they get where they can't walk right, and then they get other pains because they're using other parts of their body to try to do it, which isn't made for that. And then, you know, they become inflammatory, and then you have pain. So if nothing else, the one thing I can tell you that I'm glad that I've done that, because for my age, I can hang out with most people my age, and they can't stay up with me. And that's because I've been consistent all the way through of doing exercises. And that's because, you know, it's, as a PT, especially as an athletic trainer, you have to practice what you preach. You know, it's kind of like I had friends that would go to a doctor and he's smoking and say, no, you can't smoke because it's really bad for you. Well, you know, he kind of loses some credibility if he's doing it, okay? And you can't be morbid obese and say, okay, now you got to be doing your exercises, okay? And I hope that was helpful for you.